Welcome to the microscopic world of urine. At first glance, urine may seem simple, but under the microscope, it tells a fascinating story about an animal's health. Here we can spot red blood cells hinting at trauma or bleeding, white blood cells signaling infections or inflammation, and epithelial cells which can reveal changes in the urinary tract lining. We may even see cast and crystals, tiny clues pointing to kidney function and metabolic balance. By exploring these microscopic details, veterinarians unlock vital information that guides diagnosis and treatment, turning what seems ordinary into extraordinary insights. Urine analysis is one of the most valuable, inexpensive, and informative diagnostic tests in veterinary medicine. Among its components, microscopic examination of urine sediment provide critical insight into diseases of the urinary tract, kidneys, and even systemic condition. In this video, we will explore how to perform microscopic examination of urine in animals, what structures can be identified, and how to interpret them clinically. Components of urinalysis. Urinalysis is a comprehensive diagnostic test that provides valuable information about urinary and systemic health in animals. It consisting of three main components. The first one is physical examination, which include assessment of the urine color, clarity, volume, and its specific gravity. The second component is the chemical examination, performing using dipstick analysis to evaluate parameters such as pH, protein, glucose, ketones, bilirubin, and blood. And the third and most informative component is the microscopic examination, also known as urine sediment analysis. This involves identifying the cells, cast, crystals, microorganisms, and other formed elements present in the urine. In this video, our primary focus will be on the microscopic examination of the urine as it plays a crucial role in diagnosing urinary tract infection, renal diseases, and various metabolic disorders in animals. Next is urine collection, storage, and preservation. Urine sample quality is critical for accurate microscopic examination, and it begins with proper collection and storage. Most common urine collection methods in animal include free catch or voided sample, catheterization, and cystocentesis. Among these, cystocentesis is considered the gold standard, especially when sterility and accurate sediment evaluation are required. For bacterial culture and evaluation, we have to go for catheterization. Regardless of the collection method, fresh urine is always preferred. Ideally, the sample should be examined within 30 to 60 minutes after collection to prevent changes in cellular elements, bacteria, and crystals. If immediate examination is not possible, the urine must be refrigerated. Refrigerated urine should be stored at a temperature between 2 to 8 degrees Celsius and examined within 6 to 12 hours. So even with refrigeration, urine can be stored only up to 12 hours. Before analysis, the sample must be brought back to room temperature and mixed gently. When longer delays are unavoidable, chemical preservatives may be used. Commonly used preservatives include boric acid, formalin, thymol, and toluene. Boric acid helps maintain urine pH and preserve formed elements, making it useful for bacteriological studies. Formalin preserves cells but interfere with the chemical test and is not suitable for routine urine analysis. Thymol and toluene inhibit bacterial growth but may alter biochemical results. It is important to remember that no preservative is ideal for all urine tests. Therefore, whenever possible, fresh urine examination remains the best practice in veterinary urinalysis. Next is preparation of urine sediment. To prepare the urine sediment, first you have to centrifuge 5 to 10 ml of the urine at low speed. Discard the supernatant and leaving a small volume. Gently resuspend the sediment. Place a drop on a glass slide and cover with a cover slip. Examination is performed under low power, that is 10x for cast and crystals, high power 40x for cells and microorganisms. So this is a urine sample. Here it will look like this after centrifugation. This is the supernatant, here is the sediment. Okay, we have to discard the supernatant and resuspend the sediment and examine under the microscope. During microscopic examination of the urine sediment, the most commonly observed cellular component include red blood cells, white blood cells and epithelial cells. Each of these have important diagnostic significance. The presence of red blood cells or RBCs indicate hematuria. Hematuria may result from trauma to the urinary tract, urolithiasis or urinary tract infections or neoplastic condition. The number and morphology of the red blood cells can help localize the source of bleeding. So how the RBC will look? The RBC will have a translucent uniform appearance like this. These all are RBCs. Next is white blood cells. White blood cells or WBCs are indicators of inflammation or infection. An increased number of white blood cells in urine known as pyuria is commonly associated with conditions such as cystitis and pyelonephritis. When white blood cells are observed together with the bacteria, a urinary tract infection should be strongly suspected. The next is epithelial cells. Epithelial cells are classified into different types based on their origin. Squamous epithelial cells usually indicate contamination, especially from the distal urethra or external genitalia. The transitional epithelial cell originate from the bladder or urethra and may be seen in cases of inflammation or irritation. Renal tubular epithelial cells are of great clinical significance, as they present such as significant renal tubular injury. Accurate identification and interpretation of these cells are essential for proper diagnosis and clinical decision making in veterinary practice. Urinary casts are cylindrical structures formed in the renal tubules, composed mainly of term horsefall protein. They can trap cells, lipids or other substances, reflecting the health of the kidney. So, cast in urine indicates some problem with the kidney. Common type of cast include hyaline cast, often seen in healthy animals, or mild dehydration. Granular cast indicating tubular injury. Cellular cast, such as it can be red blood cell cast from glomerular bleeding or white blood cell cast from renal inflammation. Waxy cast such as chronic kidney diseases, and fatty cast associated with a nephrotic condition. Detecting and identifying these casts during urine microscopy provide valuable insight into renal function and helps veterinarian diagnose kidney disorders early and accurately. Next is urinary crystals. Urinary crystals can be either normal finding or indicators of disease depending on their type and quantity. Common crystals include struvite, which is often associated with the urinary tract infections. Calcium oxalate, frequently seen in dogs and cats. Urate crystals, commonly found in Dalmatian and in case of liver disease. Cysteine crystals, which are linked to inherited metabolic disorders. Accurate interpretation of the urine crystals must always take into account the urine pH and the species being evaluated, because some crystals may be normal in certain species of animals. Next is microorganism. Microorganisms such as bacteria like rods or cocci, yeast, and parasites may be observed in urine sediments. The presence of bacteria alongside increased white blood cells is strongly suggestive of urinary tract infection. Yeast may indicate sample contamination or in some cases an underlying systemic disease. Occasionally parasites such as Capillaria X can be also identified. Definitive diagnosis and confirmation often require a urine culture. Not all structures seen in urine sediments are clinically significant. Artifacts will closely mimic pathological findings and lead to misinterpretation. Common artifacts include air bubbles. Air bubbles will look like this: pollen grains or fibers and starch granules. Recognizing these artifacts and distinguishing them from true abnormalities is essential, as accurate identification helps prevent misdiagnosis and unnecessary treatment. Microscopic examination of the urine play a vital role in clinical diagnosis. It aids in identifying urinary tract infection, renal diseases, metabolic disorders, urolithiasis, and systemic illness. When urine microscopy is combined with physical examination, biochemical analysis, and diagnostic imaging, it becomes a powerful and comprehensive diagnostic tool that supports accurate clinical decision making. Microscopic examination of urine is an essential skill in veterinary diagnostic. A systemic approach, proper sample handling, and correct interpretation ensure accurate diagnosis and better patient outcome. Thank you for watching. Don't forget to like, subscribe, and share this video with fellow veterinary professionals.